Our speakers. We have a twofer today. We've got two speakers. One of them you have seen many times in the past, and it is T.J. Johnson. TJ is our insurance expert, and he navigated us all through Obamacare, affordable health care, telling us what was working, what wasn't working. He also was willing to sit down with us and on an individual basis or even in a small class and kind of explain how that works. Today he's going to specialize in COBRA, but also we're about to come up with open enrollment for affordable health care again, and so he's going to be able to answer your questions along in those lines. And he's brought a compadre with him, Bryan Potter. So let's give a warm welcome to these two gentlemen from the insurance industry.
Thanks again. Some of you have heard me talk in the past. I've been working with Launchpad for just about 2 years coming up now. I work with C4 Benefits Group. Bryan Potter is an associate of mine. We've given talks everything from COBRA. We got involved kind of in Launchpad. We know that a lot of you, through the course of meetings with people in here and that, we kind of have been able to refine what it is and some of the talks that we give and the information that's important to this particular group. We know that for some of you coming off of group, we've met with a lot of people where they've always been on group. They've always had a good job in group, but now 25 years later, all of a sudden they're in the private sector and looking at private insurance kind of thing. So the first talk I gave here about 2 years ago was about COBRA. The landscape has changed now in terms of COBRA benefits and kind of, as soon as we get this queued up, in terms of what's available and what's not available. So what we do is we're benefits consultants, and so we'll sit down with you on an individual basis and kind of help you navigate what the best choices are. It's not a sales process. We've met with a number of people here. You can talk to a number of people in here that have met with us, and you'll see that it's not a sales process or anything like that. If there is a solution and you decide to move forward on something, then we can help you with that, but it's really not about sales. We got involved here to really help people and disseminate information about what's going on. So I'm going to give a little bit of talk about COBRA and kind of the landscape and what the options and choices are for you. And then Bryan is going to talk a little bit about Medicare because open enrollment's coming up for that starting on October 15th. And then he's going to get into some of the important dates and things you should know for open enrollment for the ACA moving forward. Bryan worked for 4 years for Texas Department of Insurance and was on the forefront of the Obamacare rollout in Texas. He was the one that traveled around the state speaking to groups like this and other public agencies and groups about what was coming up and the mandates and that sort of thing. So he's an expert in that area. As far as COBRA goes, while we get this queued up, I'll kind of get started on the presentation. So COBRA is the Consolidated Omnibus Reconciliation Act of 1986, which above and all doesn't really mean anything. What it originally started as was a way for people to continue their group benefits if they were laid off. And the reason that was important back when this was started was because if you had any sort of pre-existing condition or if you had a lapse in coverage greater than 63 days, it was impossible for you to go then into the private market and get insurance because you'd get declined. And so this act was enacted to enable people to maintain their group benefits for a long enough period to hopefully become employed again. Fast forward to 2014, 2015, and a lot of that is off the table now. It doesn't matter. With the advent of the ACA, pre-existing conditions no longer matter, right? So you heard back in the old days, oh, I have to keep my job because I have group benefits because my spouse has some medical conditions or my kid has some medical conditions and we can't get insurance otherwise. All of that is off the table now. So it doesn't matter what, you can be a 3-pack a day, triple bypass diabetic, and you can still get guaranteed acceptance coverage on the private end, okay? And also, it does not affect your ability to get subsidies, which Bryan will go into a little bit later. So that's important. The other old mandate was that if you had a lapse in coverage longer than 63 days, then you had to go through full medical underwriting, and anything that they found they could exclude for up to 12 months treatment on and that sort of thing. Again, all of that is off the table now, right? So COBRA is now, people have to take a real close look at whether COBRA is the best option and whether it's not the best option. So what happens is you get laid off, they call you in, they give you a paper that says, do you want COBRA? And it has a breakdown on how much it's going to cost, and they say you have 60 days to make your decision on whether or not you want it, right? You just got laid off, everything's in chaos, you need to put food on the table. So you check the box and say, yes, I want COBRA because it seems like the reasonable thing to do. Of course, I want to continue my coverage for me and my family. This is the easiest way to do it. This is what it is. I check the box, yes. Up until July of this year, that was a huge issue because the ACA states that in order for you to sign up for an individual policy outside of open enrollment, you have to have a qualifying event. Now, a qualifying event, when you lose your job and you don't take COBRA, you've lost group coverage. That's a qualifying event. But if you elect group coverage, COBRA coverage, and then drop it 3 months later, that's a voluntary termination of benefits, and it does not count as a special enrollment or loss of benefits. So it was called the COBRA trap because people were in a panic. They signed up for COBRA, then 6 months later, they couldn't get out of it no matter what they wanted to do because they had to wait for open enrollment. In July of this year, they changed all of that. So if you're currently on COBRA and you want out of it, you can now get out of it. That now counts as a qualifying event. So it's very important to understand that. It's something that they changed because people said, well, wait a minute. A couple things about COBRA. And this applies specifically to people coming out of COBRA. What has changed? No pre-existing condition, no continuous coverage provisions anymore. It's not tied to being laid off or being fired. That's what I just covered about. You can get private benefits above and beyond that. And on the private insurance, and if you're under COBRA, right, you just got laid off, your income just got reduced to zero. If you stay on COBRA, there's no opportunity to get a subsidy through healthcare.gov. If you roll into the private market, depending on what your income is, there may be an ability for you to get subsidized healthcare. That's what the whole Obamacare, healthcare.gov thing was about. So why is COBRA so darn expensive, right? When you were working with the company, your bill was it was family of 4 and your bill was $300 a month and everything seemed great, right? So a couple things about COBRA when you roll on it onto the individual side. First of all, the company's no longer subsidizing that. The company by law is required to subsidize 50% of your health care coverage for you as the employee while you work for them. When you roll off and you go onto COBRA, they're no longer required to subsidize anything for you. The other thing that happens is now you're under the group plans are rated on community rating. That means that everybody from the 85-year-old guy down to the 20-year-old girl pays the same amount. It's all averaged out. Everybody pays the exact same amount under a group coverage. So if you're on the healthy younger end, you're helping to subsidize the less healthy or the older population in terms of what is covered under the group. It's all based upon the community rating for that group. So when you go on to COBRA, you're still under that community rating. So if you're a 30-year-old healthy person and you roll off and you stay on that group plan, you're still paying that community rate. As opposed to if you went private, you would be rated upon your age, whether or not you smoked, and the zip code that you lived in, and that's it. So that's part of the reason that COBRA tends to be more expensive. COBRA by law, they're allowed to charge you 102% of what you would have been charged under group. So they can actually tack on a 2% surcharge for admin costs simply because you're no longer part of the group and you're paying extra admin costs for them to administrate your personal policy under the group policy. The other thing that happens is you're limited in your ability to choose what plan you want. If you roll off under COBRA, you stay on the plan that you are on. Under the ACA, everybody in the family can have a different plan. I have a family of 5. I have 3 kids, me and then my wife. We have 3 different plans based upon our needs. Before the ACA came around, you couldn't do that. Children couldn't have their own policy. So I'm a 46-year-old male. I don't go to the doctor, right? My wife has to nag me just to go for my once-a-year physical, right? So I'm not going to go. So I'm going to get a cheap plan with a high deductible because I'm not going to go anyway, right? Keep my costs down. I have kids that are 8 weeks old. I have a 2.5-year-old, and I have an 8-year-old. One of them is at the doctor every single month, regardless, right? But I'm not really worried about them having a massive medical cost, right? What I'm worried about is every time they go to the doctor, I don't want to pay $50, $60, $80. I want to make sure that I'm paying $15 to $20 every time they go to the doctor. So they're on their own plan, right? Up until obviously 2 months ago, my wife was pregnant. So we had her on a very low deductible, very expensive plan, just in case anything happened, right? There was any emergencies. Now, when open enrollment comes around, we'll roll her on to a higher deductible, less expensive plan because we're out of the woods in terms of the pregnancy. This is the way that healthcare needs to be thought about nowadays. It's a moving target now. That old days of I'll just sign up because it's this and it covers this, great, I'm done. Those are all done now. So the other thing is with the advent of a new child in my family, that raises the income limit under which I can get subsidies. Because for the more people in your family, the higher income you can earn and still get a subsidy. So I went back and reapplied through healthcare.gov. I had a qualifying event, had a child, went back through healthcare.gov because now my income limit was raised. My income didn't change, but the limit that I can earn and still get a subsidy went up because I have an additional person. And now I qualify for subsidized health care. Right? So this is the kind of thing that we do. We help people sit down and take a look at this kind of stuff. I'm going to turn it over to Bryan now. Any questions about the COBRA stuff or what's going on in terms of that? The other thing about COBRA is when you're taking a look, and this is specifically for like Dell people, IBM, I think AMD does this also. When you get laid off, typically they give you 30 days or 90 days, or so I've seen packages as long as 6 months of severance. So when you get that initial COBRA bill, you're like, oh, nothing's changed. My COBRA is exactly the same. You need to ask them when your severance package, because they're not going to tell you this. They're not going to say, oh, we're subsidizing your health care. You need to ask them, when my severance package runs out, what is my COBRA premium going to be? Because it's going to explode on you. Because they're still subsidizing. I know that Dell does it for 90 days typically. IBM does it from anywhere from 90 to 180 days, typically when they give you severance, as well as AMD does it. I ran into a gentleman here that I sat down with. I said, you know, next month your COBRA premium is $1,400. He said, no, it's not. It's only going to be $600 like that. I said, no, next month it's $1,400. So be very careful that you understand that. If it's still subsidized for that 90 days, yes, go ahead and keep your COBRA because you're not going to be able to beat it on the open market price-wise. What we do ask is, if you have questions about your COBRA, or whether or not to keep it, or whether or not to take it, please don't call us 2 days before the deadline and say, what do I do? Because there's certain hoops. There is the ability to sign up for an ACA plan anytime during the year. There's some back doors and some loopholes that are perfectly legal, but it takes a few months, or it takes a few weeks to get everything in place. But there are ways to sign up for Obamacare or an ACA plan anytime during the year, regardless of whether you're on COBRA or not. But it takes about 30 days to get everything in place. So there's a sign-up sheet in the back if you have any questions. We just ask your phone number and legible email. We'll be in contact with you. I'm going to turn it over to Bryan.
This is, I think this is right, this is my little personal history. I think they mentioned I work for the Department of Insurance, the state agency. I worked in the Consumer Protection Division. I was the spokesperson for Medicare, Medicare supplements, Obamacare. I traveled everywhere in Texas and spoke. So you're like a friendly audience here in Austin, because I had to do this in like 2009, 2010 in West Texas, and people were just waiting to attack me, and I couldn't say anything because, you know, you work for a state agency. Anyhow, I know a lot about Medicare. That's really my forte. And Obamacare came along, and they kind of threw that at me too, because it's a state-federal program. And so in Texas, we're going to work with the state and federal programs, Obamacare and Medicare. And right now, you'll probably have Obamacare unless you have group insurance until you get Medicare. So it's a really kind of the cradle-to-the-grave approach to healthcare in America now. Anyhow, one other thing, I'm a volunteer for CASA, which is right up the street here, 7701 North Lamar. That's court-appointed special advocacy. You can become a person that's in charge of a child who is displaced, abandoned, neglected, abused. It's a great thing to do, to volunteer while you're in between. It's a great organization to be involved with. It doesn't cost you anything except a little bit of your time. And if you're male, and especially a minority male, they want you so badly, they will roll out the red carpet for you. Last year, I quit the Department of Insurance, and we started our own little insurance brokerage. I'm an insurance broker, and it's C4 Benefits, and I did it just for healthcare. That's really the only thing I do is healthcare related. As far as Medicare is involved, I just want to tell you this. You're looking for opportunities to work. A lot of people find a lot of work from their parents when their parents become Medicare eligible, and they're like, help me figure this out. And that's like such a joke, because if you're 65 and you have Medicare and you don't know what's going on, how is your 40-year-old child supposed to know? It's really tough. And there are a bunch of options out there. We can help anybody with this stuff. If you want to offshoot it to us, we'll help you. I just want to say, like, if we're a brokerage like us, we don't charge people anything for our services. You can call us, we talk to you, we'll help you through. The insurance companies pay us. We don't ask money from anybody. And a lot of people hesitate because they think it's like a lawyer, you have to pay a consulting fee. It doesn't work like that. Once you get this card in the mail, it's go time. If you have Medicare, or your parents, or some of you know. This means you need to do something. You've got to get your ducks in a row. But for Obamacare, well, this is my blanket statement. Obamacare, the Affordable Care Act, federal health reform, the marketplace, healthcare.gov, it's all synonymous. It's all the same thing. There is one program, there is one national program. Call it Obamacare if you want. It means that if you are a citizen of the United States, you can get guaranteed access to health insurance, period. TJ mentioned that there is a way to get in outside the open enrollment period. That's true, but there's a little asterisk there because there's a little trick we get in to get short-term medical that allows you to get into Obamacare even if you miss the period. You don't want to get penalized. Not everybody can do it. 99% of the people can, 1% cannot. The most important thing for anybody, if somebody comes to talk to me about health insurance, I say, what you really want to know is, can you get a subsidy? Correct me if I'm wrong. That's what you want to know. Will I be subsidized in my insurance? The answer for most people is yes. If your income here in these ranges, and I'm going to break it down for you really quickly. In 2014, you need to make more than $11,670 in adjusted gross income. In 2014, $11,670. That is the federal poverty level in America. If you make less than that in Texas, it creates a real black hole because you didn't make federal poverty level, and if you didn't make it to federal poverty level, the law was written with the assumption that everybody that was under the federal poverty level would get Medicaid from the states, because that's what the federal government was offering. You may have heard that we did not do Medicaid expansion in Texas, along with other states. And what that means is if you're below the federal poverty level, the law applies to you in full, but you can get no subsidies whatsoever, zero. Otherwise known as the Get Nothing and Like It plan, right? That's it. If you make $1 above that, if you make $11,671 this year and you want Obamacare and you put it down in your application, your insurance will cost less than $1 a month. I have 50 people paying less than 15 cents a month for their insurance in total. That's not all. That's not the whole story. There's more to that paying very little a month, and I'll get to that in a second. But secondly, if you make too much money, well, A, good for you, but all it means is that you're not going to get a subsidy. That's all it means. You still get insurance. It doesn't change the price. It just means that you don't get a subsidized one, which can change any minute. I thought when we started doing this, like between January 1st and March 15th when open enrollment ended, that would be it for us. And I'd have a long vacation in the summertime to do as I wanted. Wrong. No. Everybody's calling me. They got laid off. They got fired. They want to go out on their own because they want to start their own business. And they're calling. And they want to get their insurance started. And it happens all the time now. So this doesn't mean anything besides if your income is in this range, you get subsidized. Am I 1, 2, 3, 4, 5? How big is my family size? And it's only based on your taxes. Your family size is your taxes. So if you're a single person, you're a single person unless you get married or have a child or etc. If you're a family of 4, you're a family of 4 unless somebody else is claiming the kids on the taxes, like, you know, my first husband or my first wife has the kids. So it's your family size based on your taxes. This is how they look at your income. This is telling you, if you fall in this range, this is what's going to happen. For unemployed people, they get laid off in July and they made, you know, $25,000 through July and got laid off. It actually is going to work out really well if you're going to spend the next 6 months looking for a job, because your income for this year already counts. So you're in the range where you're going to get heavily subsidized. If you make more money, well, they might adjust a little bit. They do count unemployment. Thank you for asking that question. Right here it is. How do they count? Well, they include wages, salaries, taxable interest, taxable amount for pensions. Right there is unemployment compensation. You also have to cover like refunds, rental estate. What don't they cover? I always tell people it works the best for self-employed people. If you're self-employed and you are kind of in charge of your income, here's a little note. And I'm not an accountant, but this is a note. Don't go below the federal poverty level by writing things off. So I pay so little on taxes, I want to get below $10,000. Tragic mistake, because you're fully subsidized at $11,670, and you went below that trying to pay less taxes, and you just made yourself pay full price on health insurance. That can be a big mistake. By the way, the older you get, the heavier the subsidies get. So if you're like 55 to 65 and you qualify for a subsidy in any way, it starts at about $300 a month. That's the starting point of what they're paying for you. I have this sheet. It's called the MAGI form. We'll give it to anybody who wants it. This is the most important thing when you're trying to figure out what you're doing with your income. And then many people pay less than $1 a month. That's absolutely the truth. But that is not the only story to that. If you get a subsidy where you're paying very little on a monthly basis, it also means they're going to enhance the insurance in other ways. And one of that is cost sharing. So you have a deductible, right? Everybody's got a deductible on their insurance. But that deductible, if it said $5,000 for a person that doesn't get a subsidy, it might be as low as $750 for a person that does get a subsidy. The most important concept to me about Obamacare is that $6,350 is your out-of-pocket maximum, right? That's a universal truth. You can't avoid getting that if you get on Obamacare. That is the high number, meaning my worst case scenario, I leave here, get in a car accident, break my arms, my legs, my toes, I'm going to spend a month in the hospital. My bill will be $6,350. That's it. To infinity it covers after that. Universal truth. However, if I'm getting a subsidy and I'm below 250% of the federal poverty level, whatever that number is, they will also lower my deductible and lower my out-of-pocket maximum. So I have clients that pay 3 cents a month, their deductible is $500 for the year, and their out-of-pocket maximum is $750 for the year. That includes doctor co-pays, that includes prescriptions, it includes mental health, it includes maternity, etc. So if you thought for a second, I can't afford health insurance because of this, this, or this, or this, you better look, because you might be passing up just about free health insurance. Especially when in the middle of the year, your income and your employment got severed. It might work out really well for you. We know COBRA, there is one reason in the world you need to have COBRA, that you have to have COBRA. And that is you're 60 plus years old, you have end-stage renal disease, which means you have to get dialysis, and you have just quit your job where you had group insurance, but you do not qualify for Medicare yet. So if that's you, that's COBRA. There is no other reason why you take it. All right, the penalties. I can leave this for you and talk about the penalties. Let me surmise it for you very quickly. You will get penalized if you don't have adequate insurance, period. People love to say, well, $95 a year for this first year. Wrong. That's your best case scenario. It's $95 or 1% of your adjusted gross income. Okay, moving on for this year. It's almost over. Next year it gets serious. Now it's $295 or 1% of your adjusted gross income. The next year it's $695 per year per person or a percentage of your adjusted gross income. It starts getting serious really fast. The first person that finds out they have to pay $700 a year to not have insurance in 2016 is going to be upset. But it's not like they didn't know, because the information's out there. Open enrollment for Obamacare, federal health reform, the ACA is November 15th through February 15th of this year. And that's it. That's open enrollment. That's the only times. If you want it to start on January 1st and start not paying the penalty on a monthly basis, you better have it done by December 15th. So your true date is November 15th and to December 15th. It starts January 1. We also have, which is important, SHOP, which is small business that starts this year. That begins this year. And that is, are you a small business? Because you have requirements now as a small business to provide for your employees. So if you're going to start a small business, there are other rules that apply to you. And there's also some good news there, but I won't go on about that right now. So if you're involved in a small business, make the phone call and ask those as well. And there finally is our contact information. Like we said, we talk to anybody about any insurance you have. Call us up. We'll give you the consultation and tell you this is what we think you should need to do. Other than that, I thank you for your time, and thanks for having us.
Anybody have questions? Okay.
What about the Obamacare, the main government website?
Healthcare.gov?
Yeah, they talked about that having no security and extremely buggy.
I'll vouch for it's extremely buggy. Yeah, he was asking about the main website having poor security and being extremely buggy. The biggest problems I found with people is that after they did the application, the federal government didn't transmit the information for their subsidy to the carrier. And that's where I got nervous about it. As far as putting your information into the government website and it being buggy, it doesn't really alter from the IRS, because that's who you're giving your information to. When you're doing the healthcare.gov website application, it's an everything application. It's for your health insurance, it's for your children. It's for CHIP, it's for Medicaid, it's for Medicare. It will catch everything and put it to the appropriate place. The main one, what everybody wants to know, the subsidy, can I get money? Can I get the government to pay for my insurance? That goes to the IRS, and it comes right back and it gives you the determination of how much they're going to give you. So I think that it's more tied to the IRS in any way, shape, or form for security than anything else. But yeah, healthcare.gov was a disaster. We waited for 2 months for it to work. It's working fine now, as far as I know. But if you're wanting me to stand up for the federal government and say what a great website it is, you can wait, because I will not say that. Go ahead, sir.
Yeah, you mentioned something about the subsidies based on income. Does it only look at annual income, or does it also look at net worth?
No, it does have no asset test whatsoever. So it's annual income. Correct. Yeah. That might change in the future. That's speculation.
No, do they not know that, or do they just not?
It's too much work on the main part to get everybody's assets in there, and then you create a division of people. I know some very wealthy people that are paying very little right now because they're self-employed. Right. Go ahead, sir.
What's the period?
Well, if you were to apply today for Obamacare, it's 2014. So it's kind of baked in. We have to estimate our income in the year we're living in. And so it's only a year-to-year snapshot. It does make it difficult in the beginning of the year. Say you're going to sign up January 15th to start February 1. They're going to say, what's your income going to be 2015? Ugh, I don't know. I signed up for Obamacare when it first came out. I was one of the first guinea pigs because I'm self-employed. And the question was kind of ironic. It's like, what do you think you're going to make selling Obamacare this year? I have no idea. I don't know. I guess. The thing is, it comes out in the wash. So when you do your taxes, for instance, this year, they're going to look at that money on the application that you put down versus the actual IRS adjusted gross income amount, and they're going to true it up. So if you overestimated your income, you might actually get some money back. If you underestimated your income, they're going to say, you got too much subsidy, so we're going to take a portion of that back. But generally speaking, from what I've seen, it went like $8 to $10 variation. If you're lying about your income to get cheap insurance, yeah, it's going to catch up with you, because lying to the IRS is a bad idea, and they're going to know. Way in the back?
Yeah, what about the necessity of having, if you lose your job, getting the health certification proving that you've had prior health insurance?
Yeah, the letter that you used to get about having certified coverage, accreditable coverage, right? That no longer matters. Obamacare does not care. The only questions I'm going to ask you, if you would show up, what's your birthday? Do you use tobacco? Yes or no? What's your zip code?
When you get hired and you go on to a new company's insurance, aren't they going to want that certification?
No, federal health reform has changed that. They don't have to require that. And group insurance also doesn't have pre-existing conditions. So if they're asking you something like that, something's wrong. Yeah, I'm going off the tangent, but that doesn't really apply For the recording. The answer to the question is, do we need this certification to prove that we had coverage or continuous coverage when applying for a new job or moving to another insurance?
No, asking for coverage of your prerequisites is the issue.
Coverage as a prerequisite.
Cover your prerequisites consecutively going into the new policy.
Is this continuous coverage?
Yeah, the prerequisite for continuous coverage no longer applies, whether it's whether you're applying for individual coverage privately or rolling onto a new group plan. That requirement is gone.
Okay, anyone else? Okay, thank you.
Thank you.